the Executive Secretary, well represented by one of his lieutenants of the Primary Healthcare Board, the directors of Ministry of Health and directors of the agencies here present, partners present here, the state coordinator of WHO, UNICEF, and many other partners here present, and gentlemen of the press. It is with deep sense of responsibility that today I am officially declaring a cholera outbreak in Borno State. Following the reports of sporadic cases of watery diarrhea and positive rapid diagnosis tests, as well as positive culture results from the National Reference Laboratory, we are now facing a significant public health challenge that demands urgent attention and action. This outbreak is concerning, especially in the aftermath of the flooding incident that occurred on September the 10th this year. The floods have created ideal conditions for the spread of waterborne diseases like cholera by contaminating water sources and disrupting sanitation systems. We must now act swiftly to prevent further spread of this disease. As part of the flood interventions responses, Borno State Public Health Emergency Operations Center, where we are today, was immediately converted to a command and control center to commence responses under modified pillars, which include coordination, surveillance, risk communication, and community engagement, as well as essential health services, infection prevention, and water, sanitation, and hygiene. Logistics and health information management data were also included in these pillars. In order to minimize the impact of cholera outbreak, Borno State Ministry of Health received 300,000 doses of oral cholera vaccines from the Federal Ministry of Health, for which we are immensely grateful, and equally distributed these vaccines to the IDP camps and the flood-affected communities. The state is still expecting more supplies of the cholera vaccines from the Federal Ministry of Health. However, we are recording increasing number of acute watery diarrhea, which is suspicious of cholera, which is not unconnected with the flood devastation. However, you have to bear in mind our neighbors, Adamawa State has also declared cholera outbreak recently, in fact, with a lot of fatalities. We've also seen situations similar to this in Yobe. We are recording increasing number of acute watery diarrhea, and the Ministry of Health, in collaboration with NCDC the WHO, UNICEF, MSF, France, MSF, Belgium, Alima, IRC, and other partners recorded 451 cases of acute watery diarrhea, and rapid diagnostic tests, 148 samples were suspicious or positive, out of which 148 samples, out of which 20 were positive, 20 were actually negative. The rest 128 were RDT positive, or rapid diagnostic test positive. A national reference laboratory in Abuja has confirmed 17 out of these samples we have sent were positive for Vibrio cholerae, which is what is causing cholera disease. So far, we have not witnessed any death or mortality in Borno State as a result of cholera. The LGAs that are mostly affected are MMC, Jere, Kondiga, Mafa, and Mongno. At this stage, I wish to categorically inform the good people of Borno State and the media that we are having a cholera outbreak in Borno State, which is highly contagious and can be transmitted via fecal-oral route with an approximate incubation period of 2 to 5 days. Some of the risk factors of cholera infection would include poor sanitation and/or personal hygiene, open defecation, poor food and water storage and handling, insufficient potable water supply to the population so that they cannot meet with basic hygiene, and poor implementation of sanitation in our homes and places of work. Rapid onset of profuse diarrhea is the commonest presentation of cholera, and this is often referred to as rice water stools. And if this is not taken care, the person who has cholera will undergo dehydration, and if not corrected, it results in death. On this note, and in line with the current development, on behalf of the good people of Borno State, I declare cholera outbreak in Borno State. By this declaration, under one Borno health team, we are appealing to all the line ministries and agencies and departments and partners to join hands and provide optimal responses in order to control the current cholera outbreak. The media is a vital arm of the society and is hereby called upon to partner with the government and appropriately inform, sanitize, create awareness, and educate the public about the dangers of cholera and how to prevent it. In the same vein, I want to use this opportunity to express our most profound appreciations and gratitude to His Excellency, the Executive Governor of Borno State, Professor Gana Zulum, CON, MNI, FSNE, for the provision of succor to the flood-affected communities and victims in Borno State. The massive infrastructural developments, especially in the health sector, is a testimony of his concerns about healthcare delivery in the state. And we do appreciate that with his full support and support of many of you here, we were able to provide outreach postings in all the camps until all the camps were, some of them were closed, most of them were closed. And for that, I want to appreciate the rescue services, the fire services, BOSEFA, all our colleagues here, and also the volunteers, army of volunteers, some of which were from University of Maiduguri Teaching Hospital, and also individuals who have taken on flood victims. I would like to thank you for coming this morning and for you to take this message forward to the rest of Borno State, that we have now on our hands a cholera outbreak, and we need people to cooperate with us. Especially, we are going around with cholera vaccine, and we want to have full collaboration to minimize the effect of cholera on the population. We're immensely grateful to the Almighty Allah for sparing the lives of people through cholera outbreak. So far, we have not witnessed. Thank you very much for these very important questions. For the first one, on the clarification of the numbers that I reeled out, we had total suspected cases per LGA, and the grand total was 451. And this covered Jere, Konduga, Mafa, MMC, and Monguno. Out of these 451, some of them underwent a rapid diagnostic test. We shorten that as RDT, out of which 128 were positive RDT, which means it's highly suspicious that these cases could be cholera. And 20 were negative for RDT. So immediately those which are negative, you discount them as cholera. So we sent these samples to the National Reference Laboratory in Abuja, and they confirmed, out of all these numbers we sent, 17 were positive as cholera. So we only deal with these cholera cases. And because we already suspected them to be cholera, we were treating them as if they were cholera, giving all the appropriate management. And by the time confirmation came through, patients were better, and some of them were discharged home. So that is how we were able to manage the patients, and were able to had a zero mortality rate for this episode. Now, the issue of cholera vaccination, we flagged it off sometime last week, and we have had 300,000 vaccines from the Federal Ministry of Health, National Primary Healthcare Agency. As a matter of fact, we're expecting any moment now 600,000 more doses, which will come our way. And the target initially was to go to the camps, and all those in the camps were vaccinated, children and women. So therefore, because a mother can easily contract the cholera from the child, cholera does more harm in the less than 10-year-old group, and therefore, we were giving the vaccine to children as well as the mothers. And then we went out to the community. I'm very grateful to many of my colleagues here who had to cross waters and difficult terrains to reach out to some communities who needed the vaccination, and we're grateful that people turn out, and in some places we had to go house to house in order to offer the vaccination. This is how it's going on. We've not stopped, and the process is going on. So far, we have vaccinated 287,708 people, children and adults, with the cholera vaccine. And the target is any child who is older than 1 year, and vulnerable group have also been included. We are expecting 600,000 vaccines, and we are able to then use this to reach out to the any areas in Borno State where cholera happens to be suspicious, or where we can be able to offer the vaccination. So with the 287,708 people vaccinated, it means we have offered 96% coverage. This is excellent. This is beyond our expectation, and we're immensely grateful to the people of Borno State for accepting this. And without their acceptability, we would have been facing a different scenario altogether. Many would have died. But people have come forward, and we also go after them to their respective houses and communities, and by so doing, we have able to attain 96% coverage. And that is one reason why the mortality is zero at the moment. I hope Abba comes in during the rainy season. And that's when you see cholera outbreak in the whole of country, Nigeria, especially in the northern parts, when during the rainy season, because of small circulation of floods, mini floods, cholera tends to come up. And therefore, we have been screening for cholera since January this year. And until recently, we have had 62 samples which we sent to National Reference Laboratory. Only these recent ones were positive. And therefore, cholera, we were prepared for cholera. We know that with the floods that we have had in Maiduguri, cholera is one of the diseases, waterborne diseases, that we were expecting, and we were prepared. And hence, we're very grateful to His Excellency, the Executive Governor, who was able to reach out to the Federal Ministry of Health and National Primary Health Care, so that the provision of cholera vaccine was fast-tracked. It was fast-tracked for Borno State, and as soon as we received it, we started the vaccination. And that is the degree of level of preparation. We've also had all our staff well educated about cholera, and we set up 3 to 4 places within Maiduguri where cholera cases can be attended to. And these were people who are well trained, and we had all the equipment, like the personal protective equipment, PPE, available, and therefore, in a nutshell, we were prepared for cholera. So when it came, it's not surprising for us, and we did what is required of us. Thank you to all of you here, and especially our partners, who really, without their help, we would have been struggling. They really assisted us, and we're very grateful to them. So, some of the cholera centers, as you are well aware, are within metropolis, and therefore this really greatly helped. Anybody with watery diarrhea is taken there, testings are done, and if suspicious, is treated as if it's cholera until we get the confirmation from the National Reference Laboratory. Without confirmation, we cannot call any case cholera. It has to be confirmed from the National Reference Laboratory, and they have seen the cholera Vibrio cholerae, and then they can declare that to us. Thank you.
Yeah.
Already informed you that there are risks associated with cholera. You have to maintain cleanliness. You have to wash your hands regularly. When you go to the toilet and you come back, you wash your hands. We do that, but this is for those who are not here, for them to understand. The risk is also that those who handle food must now pay particular attention to hygiene. It's very important. And those who have got very young children, you have to be very careful. If they have any diarrhea, then you have to seek medical advice. So if we follow this, and also to ensure that mothers do take their children and offer themselves for the vaccination, we have enough that will be able to go around so that, we minimize the risk of cholera, doing any devastation to Borno State. As I said, states like Adamawa, over 60 people died from cholera. So it is quite serious. Therefore, this preparation that we made and anticipation of cholera has greatly assisted us in minimizing the mortality or making it zero at the moment. So we urge you all to please, continue with these things that we've advised, and also pay attention, and also please, although we have achieved 96% coverage, we want to make it 99%. It's not even possible in many places in the world to get 99% cover, but we are urging that we go for that, So therefore, we appeal to the media to carry on, with this message, so that as soon as we get the 600,000 doses, then we can go out to all the areas that are necessary. Thank you.
Thank you.